Hello, doctor. First of all, let's start with the ethical and counseling part. And in the ethical and counseling, let's start with colleague scenarios. Okay. So please remember that colleague scenarios are some of the scenarios where you have to talk to your colleague about some ethical problem that has arisen that you have noticed about your colleague. Okay, so it's one of the blood two stations where it's the only blood two stations where you are observed while talking to your colleague. So all the other blood two stations, they check your skills, your communication skills while you are talking to patients, but here they're checking your communication skills with your colleagues. So in these stations, you need to work on your tone. Okay. So as you are discussing an ethical problem, an ethical complaint about one of your colleagues, some people they use a very harsh tone. You don't need to do that. You don't need to sound like a policeman. Okay. And some people, on the other hand, they become over friendly. So you don't need to become over friendly either. So you do not need to act like a friend or a sibling, and you do not need to act like a policeman. But you need to take a middle road, okay, and you need to sound neutral, non-judgmental, and sympathetic with your colleague as well. Okay, the other point is that these stations are very, very, very important. These are one of the most high yield stations, and there is almost one scenario from these stations daily in the exam. Okay, so be prepared for these stations when you go for your exam. All right. So first of all, I will walk you through the general approach to these stations, and then we'll go through each of the specific scenario one by one. But the main thing that you need to remember is the general approach. Okay, don't copy me word by word. Don't try to memorize my words. Don't try to memorize your scripts, and don't try to memorize whatever your academy have taught you. On the other hand, just take the basic message with you and remember the general approach. You need to remember the general approach on your fingertips. Okay, so that will give your consultation the fluency. Okay, you would need to know what you are going to do first, then what you are going to do next, then next, then next. Okay, so if you remember the basic steps and you fill the steps with your own words, you won't sound scripted, and you won't sound haphazard either. All right. So let's go to the general approach first. So there are 7 steps for any colleague communication station. You need to introduce yourself. After that, you need to inquire. Okay, you need to make the inquiry. You need to ask your colleague about the problem or the complaint that has arisen, that you have noticed or that has arisen against them. After that, after you inquire, they might admit, they might not admit. Okay, so then you need to offer confidentiality. So confidentiality is the third step. All right. After offering confidentiality, some of them might admit, some of them might not. So the fourth step is impact. Okay, you need to discuss the impact of the problem, that what this ethical problem, what issues this ethical problem can cause for your colleague, what issues this ethical problem can cause for your patient in the future. All right. So the colleagues who do not admit their fault or do not take their responsibility after offering confidentiality, they will always admit to their problem after you discuss the impact with them. After they admit or after they confess, then you need to take a little bit of history. Then you need to agree with your colleague on an action plan. All right, and you need to arrange at the end, you need to arrange a further meeting. So this is like the follow-up part, right? So first of all, let's go through cocaine abuse station. So sometime you are told that there is a medical student who is taking rotation in your ward, and in a party you noticed that he has been sniffing cocaine. Also, you have noticed today that he is generally hyperactive, and nurses are also talking that he is not his usual self and he's more hyperactive than usual. Okay. So now you need to talk to the student about this, and you need to, go through all the steps. Okay. So the first step, we know that it is introduction. So introduce yourself. But here, so normally when we introduce yourself, we start like everyone has their own approach, but usually people start, hello, my name is Dr. X, I'm one of the F2s. So here, as you are talking to your colleague, you do not need to refer to yourself as doctor. Just use your first name, okay, and say I'm one of the F2s. all right? And you must be whatever the name they have given, you must be John Smith or whatever, all right? And then a little bit small talk. So how are you doing? How is the tuition going? Do you like it here? Okay, a little bit of small talk as you do with like in every like daily routine. You talk to your colleagues, so you do even if you have to ask them a favor or you have to discuss something important with them, you do a little bit small talk before that. You do not directly jump to your point, all right? So here you need to do the same, a little bit of small talk, okay, and then move on to the next step. Do not overdo the small talk, all right? Okay, so the next step is after introduction, the next step was inquiry. Okay, so now you have to inquire, but do not do it very bluntly. Do not say like, I think you've been smoking cocaine, and so that's why I have like called this meeting. No, so you need to put it a little bit diplomatically. You need to say, I wanted to talk to you about something that I noticed in the party last night. So I felt like you were sniffing something, and I was under the impression that it might be cocaine. So can you just tell me if you have been using cocaine at all? Right? So a little bit diplomatically with paraphrasing it. So after introduction, inquiry, the third step was confidentiality. So if student might admit here after inquiring, he might admit right away. So then you do not need to go to the third step, which is confidentiality. But if he does not admit, he say, no, I wasn't using it, then you need to go to the third step, offering confidentiality. So here you just tell him that whatever we discuss will remain confidential. No need to say between me and you, no need to say between me and my team. Uh, no need to say these things, just say whatever we will discuss will remain confidential. Okay, and give him a reason as well. The reason that I'm asking is because you are more hyperactive than usual, and the nurses were also talking about this. Okay, so this is the offering confidentiality part. After that, the impact. If he does not admit after the offering the confidentiality, he will for sure admit after you discuss the impact with him. But do remember that even if he whether he admits or not, you still have to discuss the impact of the problem, because you need to show it to the examiner that you know what impact this problem can cause and you are aware of the good medical practice. So you need to tell him that we as medical professionals are not allowed to take drugs during our lifetime because we have some ethical obligations. So this here refers to the GMC good medical practice, which says that medical professionals cannot use drugs, okay? So please remember that this sentence applies in all scenarios. You cannot use drugs during our lifetime, even if you are on holiday. Okay, even if you are on another planet. All right. You cannot use drugs if you are a medical professional, and that is the end of story. All right. So if he is a medical student, so university is responsible for him. So you will tell him that if this is reported further, the university might take action against you and might prevent you from obtaining medical degree. So that's why I wanted to give you some advice on that. But if he is a junior doctor, then this part will be different. You will tell him that if this is reported further, then the GMC might take action against you and might revoke your license. Okay. So if it is a student, he will be reported to the university. If he is a doctor, he will be reported to the GMC. If he is a student, then the university might prevent him from obtaining degree. And if he is a doctor, then his license will be revoked. Okay. So this is the impact. After that, when he agrees that yes, I might have been using it, then you need to take a little bit of history. Okay. So since when have you been using it? Do you use it regularly? How much do you use it? How often? And why do you use it? This is the most important question, that why do you use drugs? Is there anything going on with you? Do you feel low sometimes? Okay. Is everything all right with you? Because you need to be sympathetic with your colleague. You need to find out whether he's going through any tough time, whether he's depressed, and offer support. So you need to ask him, why do you use drugs? Do you feel low sometimes? Okay. And is there anything in specific that is pushing you towards using drugs? All right. So after that, there is action plan. So if he is a student, you need to tell him that please speak to your educational supervisor about this and please avoid taking it again. Okay. So if he's a student, then this part is easy. Ask him to talk to your educational supervisor and ask him to avoid taking it again. But if he's a doctor, then this part here will be a little bit more tricky. You need to ask him whether he has been seeing any patient, whether he has discharged any patient, whether he has described some medications, and you need to ask him about the list of the patient that he has seen today. Okay, you need to take that list from him and go through the list again, review all the patients again. Okay, ask him to take rest, leave the ward premises, and you will tell him that we will need to talk to your educational supervisor and the ward consultant. Okay, so for a doctor, it is different because a medical student is just a passive observer. He is not doing any procedures, he is not prescribing any medications, he is not discharging any patient. The doctor is actively involved, so that part, the action plan part, will be totally different for these two. Okay, and then the catch-up part or the follow-up part. So you will arrange a meeting next week. Okay, you will tell him that I would like to see you next week again to see the progress, and I would like to know what have you done about this. Okay, so this was the cocaine abuse scenario. We'll discuss the rest of the scenarios today or maybe tomorrow. And if you have any queries, please drop in the comments and I will answer as soon as I can. Also, please tell me if there is any problem with sound quality or anything at all. And I hope it helps. Thank you.